Thank you and welcome to our group's presentation on suicidality amongst LGBTQ adolescents and utilizing cognitive behavioral therapy as an effective intervention. Numerous research studies have been conducted on the disparities facing members of the LGBTQ population. Our group looked at two particular studies completed by Thoma et al. And Sevastopol et al. They conducted research surrounding the disparities and risks for suicidality amongst transgender and cisgender adolescents. Both studies found that transgender adolescents and other non-binary sexually minority youth were at elevated rates of suicidal ideations. Their studies also found that transgender and sexually minority youth have higher rates of suicide attempts than that of heterosexual youth. Transgender and sexually minority youth experience more trauma, violence, and present with greater mental health needs. Transgender and LGBTQ youth have higher suicide rates and suicidal ideations. As we all know, suicide is a leading cause of death in teenagers and young adults. Depression, anxiety, violence, and suicidal ideations are higher among sexually minority youth. The identified issues to be addressed by social workers, mental health professionals, and other practitioners included the mental health and suicidality symptoms that ranged from depression, anxiety, increased substance use, fear, self-harming behaviors, suicidal attempts, and suicidal ideations. The literature suggests that transgender youth or gender non-conforming youth that have a strong familiar support and strong relational attachments tend to cope better with the negative encounters, encouraging us to build those family bonds. Suicidal thoughts and behaviors range from considering suicide, creating a suicide plan, to making a suicide attempt. So there are a lot of areas to where we can intervene and hopefully prevent some of these tragic events. The research identified the top 5 predictors of suicidality to be peer victimization. LGBTQ youth often are targets of aggressive behavior by non-siblings. We can also equate that to bullying. Another predictor was depressive symptoms. Another was the increased likelihood of future drug use, if not current drug use, along with experimentation. The fourth predictor was the interaction between help-seeking behavior for depressive symptoms. There are a lot of things that prevent youth from seeking out services, and which would include like the stigma associated with going for counseling or the frequency or duration of the depressive episodes, along with socioeconomic status, amongst other factors. And the last predictor was past suicidal ideations and attempts.
What is CBT? CBT, cognitive behavioral therapy, is a form of psychotherapy that focuses on the role of cognition in the expression of emotions and behaviors. CBT assumes that maladaptive feelings and behaviors develop through cognitive processes which evolve from interactions with others and experiences in the environment. The goal of therapy is to identify the maladaptive cognitive process and learn new ways of perceiving and thinking about these events. These new ways of thinking will lead to a more positive behavioral emotional response.
CBT, or cognitive behavior therapy, is carried out in a structured therapeutic setting. The settings are usually in an office between a clinician and an individual, or families, or a group. The therapeutic sessions are usually carried out in sessions. Sessions can last from 30 minutes to 60 minutes. They're usually performed weekly or bi-weekly, and the sessions can be from 5 to 20 sessions. During these sessions, a clinician will help build a sound therapeutic alliance with the client, build on the client's strength, assist the client with alleviating stress through cognitive restructuring, problem solving, and skill training. CBT has been known to be effective with many mental health issues. Researchers have shown that cognitive behavioral therapy has been most effective in reducing the recurrence of suicidal self-directed violence. In this diagram, it describes a cognitive behavioral therapy session and how a clinician will provide the family or the client with education on the issue of suicide. They will reduce the factors by reducing depression or homelessness or whatever other issues that makes the suicidal issue a problem. They will enhance effective coping skills by helping them mood regulate or problem solve. They will minimize social isolation. So they will gradually establish a new social network, and help the client find new supports. They would introduce medication or increase medication if already used. And the final step will be providing a safety plan for the client. CBT is carried out in a therapeutic setting to help clients to regulate their thoughts of negative thoughts and reduce their risk factors, and to build a safe plan. Okay. Who can use CBT? CBT can be used with almost anyone. CBT can be used in the treatment of individuals, groups, or families. It has been shown effective in treating suicide ideations, depression, anxiety, eating disorder, bipolar disorder, and obsessive compulsive disorder. CBT can be administered by a clinical social worker, professional counselors, psychologists and psychiatrists, and clinical counselors. CBT is widely used for non-psychological disorders such as irritable bowel syndrome or chronic fatigue syndrome, fibromyalgia. These are just other ways that CBT can be used. But there are some limitations in using CBT. CBT is not recommended for children under the age of 7, and it's not suitable for complex mental health needs or people with learning disabilities, as it requires structured sessions where clients are required to sit down and analyze their thoughts and confront their thoughts. So sometimes they're not, it's not recommended for complex or mental health.
So moving on to specific cognitive behavioral therapy techniques that are helpful when working with LGBTQ youth. It's pretty similar to working with really any population using CBT, but there are some slight differences. So it follows the course of reframing and refocusing negative cognitions and thoughts. And so really first thing would be defining helpful and harmful thoughts. So making that difference, out loud and figuring out what the client is thinking, really, and then defining them as helpful and harmful. And then after that happens, um, it's helpful to identify patterns of negative thinking. So, what are these harmful thoughts and how often are they happening? What leads to them? And then connecting the client's thoughts with behaviors and feelings, right? And you can kind of see it in this image from mind, my feelings. Um, there's the situation that the client's experiencing and the thoughts and then their reactions. So it's really connecting a client's thoughts, reactions, and situation, and connecting all of their emotional, physiological, and behavioral. And so that basically we're helping clients be in tune with their thoughts, behaviors, feelings, and how that's leading to their reactions. So, so those techniques are really used in all CBT. But more specifically for this population, is discussing core beliefs. And when working with LGBTQ youth, a really important core belief to focus on is internal oppression. So, of course, there's oppression in the outside world for our clients, especially LGBTQ folks. They're experiencing oppression from the media, society. It's a lot. And focusing in on that core belief. If our client has a core belief of internal oppression, that's something that really needs to be addressed. And then we can look at, and you can see in this image, the core belief is really at the bottom, right? It's what our clients actually really deep down in their core believing. And then you get to how that feeds into intermediate beliefs. So attitudes, assumptions that come from that core belief. So in this instance, if the core belief is, for example, an LGBTQ individual could at their core believe, I'm not correct or I'm not right for my, because of who I love, or who I'm attracted to. And maybe at the core, it's this internal oppression. And that leads to intermediate beliefs, so attitudes and assumptions about themselves and the world around them. And then that leads to automatic thoughts. And so the automatic thoughts is really what we want to get to, reframing and refocusing. That has to come from the core beliefs. So then we get into really balancing alternatives with negative thoughts. So if the negative thought is, and this is coming from that core belief of internal oppression, if the negative thought is, I don't fit in, right? We challenge that. So first there is that challenging, and then reframing. So challenge it, us as a therapist would say, well, why do you believe that? And then get into, well, what if that's not true? And then reframing would be, well, what's this concept of fitting in that you're talking about? And so we get into really balancing those alternatives with those negative thoughts. For every negative thought, we need to balance it out with an alternative. And a huge part of working with this population is really facilitating and encouraging self-love and empowerment, because ultimately it's a cycle, right? Where there's that internal oppression and external oppression. And if we're helping clients and guiding them to have this self-love, and helping them to feel empowered, because that's ultimately our goal, right? Then they're able to empower others. And it pretty much leads into a cycle of empowerment and self-love that spreads and helps our clients and helps the community overall.
So why is CBT used? CBT is used while working with suicidal clients, but specifically adolescents in the LGBT community, because CBT provides the ability for clients to learn and solve new problems as they arise, and develop coping skills. CBT can improve and restructure the negative thinking patterns to reduce anxiety. When we incorporate mindfulness with CBT, this can help focus clients on more positive aspects. Mindfulness is particularly useful when clients engaged in maladaptive thought process, such as obsessing, ruminating, worry, self-criticism. It's also quite useful when clients are fearful of experiencing certain internal stimuli, which as negative emotions, thoughts, images, cravings, or pain. CBT can be used also to empower clients to focus on what could be ahead versus what was. We can teach clients that problems will continue to arise and it's our reaction that dictates the control. CBT also addresses the individual's thoughts, emotions, feelings, and behaviors that encourage the individual to assert more authority of their feelings. As we work with adolescents in the LGBTQ community, they may experience bullying, taunting, name-calling, shaming, etc. that would cause potentially serious distress within themselves. As therapists, we would want to recognize the 5 predictors of suicidality that were mentioned earlier: fear of victimization, depression symptoms, increased likelihood of future drug use, interaction between help-seeking behavior for depressive symptoms, and past suicidal ideation and attempts. While recognizing these, during a session, we would use the CBT skills of evaluating negative thoughts and core beliefs to allow space for a client to find significant relief and the skills that are needed for success.
CBT aligns with social work practice because it's a really powerful tool that really greatly aligns with social work values. So I'm going to go over the three different values in the NASW Code of Ethics that CBT really aligns with. The first is dignity and worth of the person. CBT really involves helping clients examine options for change and problem solving by enhancing a sense of control and self-efficacy over their problems. So what this really means is that we are valuing the dignity and worth of a person by making sure that we're valuing self-determination. And CBT is really great at that because it is a tool that social workers can use that at the core of it really is the belief that clients have the tools inside of them to conquer their problems and live meaningful lives. And CBT is really just about reframing and refocusing your thoughts. The second value that it aligns with is the importance of human relationships. CBT is really all about being with the client and not for the client. So it's a really collaborative technique where the therapist is really working with the client and using the tools that are already inside of our clients. And the third is social justice. And so it kind of laid it out in sort of across a line of that society has oppressive policies and beliefs. So for our clients, that's anti-LGBTQ legislation and beliefs. And that can lead to internalized oppression and distorted cognitions. So by changing that, and like how I described in earlier slides in the techniques, is by refocusing and challenging harmful cognitions that come from that internal oppression. That leads to empowerment, and empowerment leads to dismantling oppressive policies and beliefs. So it really does feed into social justice.